Can chemotherapy stop bladder cancer from returning? Imagine battling bladder cancer and wondering if treatments can help keep it from coming back. Chemotherapy is one of the main options doctors use to manage bladder cancer, especially after surgery. When bladder tumors are removed through a procedure called transurethral resection, doctors often recommend intravesical chemotherapy. This means placing chemotherapy drugs directly into the bladder to target any remaining cancer cells. Research shows that this approach can significantly lower the chances of the cancer returning. For example, studies have found that patients who received intravesical gemcitabine after tumor removal had about a 35% recurrence rate over 4 years. In comparison, those who did not get the drug had a recurrence rate of around 47%. This indicates that intravesical chemotherapy can be effective in reducing the risk of bladder cancer coming back, especially for non-muscle invasive bladder cancer, which is confined to the lining of the bladder. The most common drugs used for this purpose include gemcitabine and mitomycin. These are administered shortly after surgery and are generally well tolerated, with side effects that are manageable. The goal is to kill any remaining cancer cells and prevent them from growing back. For patients with higher risk or more aggressive types of bladder cancer, chemotherapy may be combined with immunotherapy, such as Bacillus Calmette-Guérin, which helps boost the immune system to fight cancer cells. However, it is important to understand that chemotherapy does not guarantee that bladder cancer will never return. Bladder cancer has a tendency to recur, which is why ongoing surveillance with regular cystoscopies is crucial. The decision to use chemotherapy, the timing, and the specific drugs depend on individual factors like the tumor's size, grade, and how aggressive it is. In summary, chemotherapy, especially when given directly into the bladder, can help delay or prevent bladder cancer from returning. But it is part of a broader treatment plan that includes careful monitoring and sometimes additional therapies. Always consult with healthcare professionals to determine the best approach for your specific situation. Remember, managing bladder cancer involves a combination of treatments and vigilant follow-up to give you the best chance of staying cancer-free.